Hi, I'm Dr. Greg Having. I'm an associate professor at The Ohio State University. So what is antibiotic use and antibiotic resistance and stewardship in calf production? Let's start by defining what a bacteria is and why antibiotics are used. So what are bacteria? Bacteria are single-celled microorganisms that exist in communities of millions. They can either be beneficial to health or they can make people and animals sick. Regardless, they exist everywhere. However, many types of diarrhea aren't caused by bacteria. They can be caused by viruses or protozoa or nutritional problems. So what is an antibiotic? An antibiotic is a medicine that either inhibits or destroys bacteria. When used properly, antibiotics, of course, are very useful to save human and animal lives. However, antibiotics are not useful to fight viral or protozoal infections. For example, a common cause of diarrhea in calves is Cryptosporidium, which is actually a protozoa, which antibiotics aren't useful to treat. In calves on the farm, antibiotics are commonly used to treat gastrointestinal disease, respiratory disease, or naval infection. We want to make sure that calves that are sick with bacterial infections get the right antibiotic. However, we don't want to treat those calves that have either protozoal or viral infections where antibiotics are not going to have an impact. For example, most causes of calf diarrhea are not caused by bacteria. If you were to use an antibiotic on a calf where Cryptosporidium is the cause, the calf wouldn't improve. Anytime an antibiotic is used, it promotes antibiotic-resistant bacteria. So we want to be careful about when we choose to use antibiotics. Antibiotic resistance is when bacteria have adapted the ability to continue to grow even in the presence of the right concentration of the antibiotic. The bacteria can acquire a genetic change that allows them to resist the effect of the antibiotic and spread that genetic change to other bacteria. Antibiotics also destroy the good bacteria that live in the gut of the calf that are important for proper digestion. When the good bacteria are killed, that leaves room for the pathogens or the bacteria that make calves sick to grow and spread. Any bacteria, whether it's beneficial or whether it makes calves sick, can acquire those changes that result in antibiotic resistance, and that results in the ability of those bacteria to continue and thrive and grow even in the presence of antibiotics. This is where we get the term resistance. Those genetic changes, even if they were in beneficial bacteria, can spread to bacteria that make calves sick and result in antibiotic-resistant infections. The spread of resistance is in large part due to the ability of these bacteria to spread and thrive. The antibiotic-resistant bacteria can multiply, especially without the competition from the beneficial bacteria that might have been destroyed by the antibiotic. It's a concern because the antibiotics that we use to treat calves for their illnesses are the same antibiotics that physicians need to treat infections in people. With more resistant bacteria, treating infections in animals and people would become more costly and more difficult to treat. If resistance is pushed too far, some cases of bacterial diseases will become untreatable by available antibiotics. This is where you can make a difference by becoming an antibiotic steward. Antibiotic stewardship is a strategy to reduce the need for and better target antibiotics in both human and animal medicine. We can use fewer antibiotics by exploring ways to better target antibiotics to those calves that are likely to benefit from them, by looking for alternatives to using antibiotics, and of course by preventing the disease to begin with so that we reduce the need for antibiotics overall. The benefits of antibiotic stewardship are fewer new cases of disease, better outcomes from your therapy, and less antibiotic-resistant infections that can resist the effects of the medications that we currently have available to us. Some of the tools that you can use to become a better antibiotic steward are learning how to assess your calves for disease and learning how to follow written treatment protocols. In our next video, you're going to learn how to assess calves for common diseases. Thanks for watching.